Hello, today we will be showing you step by step on coronal polishing. First, our DA will be opening our sterilized equipment, and as always, our basic setup presents our mouth mirror, explorer, and cotton pliers. Then our Profi cup, Profi brush, disclosing tablet, Profi paste, cotton rolls for isolation, HVE, and saliva ejector. Once that's set up for the RDA, the RDA presents the disclosing tablet to our patient in order for the RDA to see where the plaque may be. Then it is explained where the polishing is needed. Once explained, we then cover the Profi cup full with Profi paste and place on pink areas. The strokes move away from the gum line. We use a mouth mirror to retract the cheek to further reach the back of the mouth. Remember to use suction. From there, we proceed to use the Profi brush to get in between the teeth. This helps the RDA to clean more thoroughly and allow the paste to clean interproximal areas. Keep your strokes outward and away from the gingiva. Once done, the patient rinses and the RDA flosses in between the teeth. The patient is then instructed on how to brush and floss daily and return every 6 months for cleaning.